Good afternoon. I'm Ellen MacKenzie, Dean of the Johns Hopkins Bloomberg School of Public Health, your host for today's extraordinary symposium on the scientific integrity of the COVID vaccine trial effort. On behalf of our remarkable faculty, students, and staff, I'd like to extend a warm personal greeting from our school. Now, I'm sure, like me, you've learned a great deal today about the challenges we face in developing, testing, and using safe and effective COVID-19 vaccines, and why these vaccines are going to be so essential to our shared human struggle to control the COVID-19 pandemic. That effort would not be possible without the sustained scientific leadership and resources of the world's largest funder of biomedical research, the U.S. National Institutes of Health. The NIH is a national treasure, and we are truly fortunate that at this difficult time for our country and the world, the NIH is led by our final speaker, Dr. Francis Collins. Dr. Collins has directed the NIH since 2009. He's a physician geneticist, best known for his leadership of the International Human Genome Project, for the visionary All of Us Genetics research effort, as well as his extraordinary abilities as a scientific communicator and leader. It is my great honor to introduce Dr. Collins.
Thanks very much, Dean MacKenzie. And it's a pleasure to have a chance to speak at the end of what has been a really interesting and information-laden conversation over the last 3 hours. It's always interesting when you get invited to summarize a meeting, you kind of figure you better show up and listen to the rest of it. Although occasionally I found myself summarizing a meeting I have not attended. It's not a pleasant experience. So I'm glad to say it was possible for me to put everything else pretty much aside this afternoon and listen to these multiple speakers in these 5 panels and learn quite a bit about what's going on in this very important subject of vaccine developments for COVID-19. And I'm deeply engaged in that, talking to you from my home office, where I've kind of been hanging out for the last 7 months, trying to run a $42 billion a year organization and putting 100 hours a week into this effort to try to be sure we're doing everything possible on COVID-19. We've talked particularly about vaccines. I could give you a whole spiel about what's happening with therapeutics, but that's not been today's topic. I think it's fair to say, though, that despite a lot of the political noise, the science is really going well. In fact, it's going extremely well if you compare it to anything that we've ever tried to do before. When I noticed, for instance, back in March that this was going to turn into a really major need for bringing people together and asked companies to gather with NIH and other government agencies, as well as FDA, CDC, the foundation for NIH, into something we call ACTIVE, Accelerating COVID-19 Therapeutic Interventions and Vaccines. I thought that might take a matter of a few months to actually pull it off, to have that kind of a partnership develop without causing all kinds of legal issues. We did it in 2 weeks because everybody saw the critical need for that kind of gathering of all of the ideas around the same table. ACTIVE has played a significant role in everything we've been talking about today by its bringing those experts together. The fact that we were able to develop a harmonized protocol for vaccine trials, which is now being utilized by all the trials you heard about, was a consequence of that. Of course, then that required resources to be able to see how we could run those trials rapidly and connect them up with at-risk manufacturing. So if trials were successful, you would have doses ready to go. And that's where Operation Warp Speed came into the scene, an unprecedented gathering of government agencies to work together with substantial resources from the Congress to try to do all of this in record time. And it has been record time when you look at the way in which we've gone from just knowing about this virus a little bit in January to where we are now with 4 phase 3 trials underway and 2 more to get started fairly shortly. I just want to be reassuring, though, about the way in which the science has been going forward. It is called warp speed, and that I think has turned some people off because that sounds like it might be cutting corners and taking chances. Well, it is cutting corners with bureaucracy. It's cutting corners with dead space of timetables that didn't really have to have long delays, but usually do. It is certainly not cutting corners with safety or efficacy. And I got to give a big shout out here to Peter Marks of FDA, who spoke to you in the course of the afternoon about how that is being adhered to. And let me just walk you through, for anybody who still has a lingering doubt about whether the vaccines will be reviewed in a fashion that demonstrates safety and efficacy, what has to happen? First of all, you have to have a highly powered, well-designed trial. That is true of all these trials in terms of their scale, in terms of the harmonized protocol that they're utilizing. Secondly, you got to have a DSMB, a Data and Safety Monitoring Board, that is going to watch very closely, being the only unblinded group who can actually start to assess whether there are events and whether they are in fact beginning to show evidence of efficacy, or could it be there's actually an adverse event, either a safety issue or that you have enhancement by the vaccine, which we have to look for. The DSMB in this situation is the same group for all of these trials except for one. Pfizer is on their own track. All the other trials that are funded by Operation Warp Speed have a shared DSMB. And if you think about what was said earlier about the importance of being able to detect a rare safety problem, the fact that you can look across these trials, if for instance it's a safety problem that might be related to the epitope, which is the spike protein, you would find that out a lot sooner with the shared DSMB than the traditional way of doing things. So the DSMB has to look at this. Then if they believe that they have seen something that might suggest that there is efficacy and good safety, they go to the company, and the company then has to decide whether they are ready to submit an EUA to the FDA. Notice that the company CEOs have already publicly stated they are not going to put something forward that they don't believe meets those high standards. They don't want to ruin their reputations either. Now, with FDA having made it very clear what their safety and efficacy guidance is, and if you didn't see today, the materials they sent out in advance of the VRBPAC meeting, which is coming up on October 22nd, but the briefing materials were sent out today. Go look at Appendix 2. That's where these guidelines for safety and efficacy are very, very clearly stated. That means FDA has already let everybody know what has to be achieved in order for them to consider that EUA. But as you heard from Peter, that's not the end of it. Then they want to have a public discussion where everybody can see what the data looks like. That group, the VRBPAC, will then make a recommendation. FDA will decide whether to accept it. And only then would we be in a circumstance where an emergency use authorization would be approved. So walking through all those steps, even though I know there's a great deal of anxiety about mischief here, it would be pretty darn hard for mischief to derail this process. And I hope everybody kind of can start to get calmed down about that. Furthermore, then once we have, and I believe I'm one of those who's optimistic, we will have one or more vaccines that turn out to be safe and effective by sometime around the end of this year, maybe a little bit into January. Then I do think the distribution plan that you just heard about from the National Academy panel that Helen Gale co-chaired, and the way in which the ACIP from the CDC will follow up on that you heard about from Dr. Bennett. We're in a very good place to be ready for that with all of those at-risk doses that have been supported by Warp Speed ready to begin to be distributed. Finally, I would say I'm really glad we had this final discussion about the last panel. We in the US have been so focused on ourselves, for the most part, that we haven't paid enough attention to the fact that we're part of a global community, and that we have a moral imperative to consider that as part of any plans that we're making. And that clearly needs to be worked on, probably and talked about a bit more than it has so far, given our tendency at the moment to look in the mirror at ourselves. So in summary, I would say we should be pretty confident that there is some terrific, in fact, unprecedented science going on that should give people confidence that we are doing the things necessary to try to arrive at solutions for this worst pandemic that the world has seen in more than 100 years. But all of that has been overshadowed, let's be clear, by political noise, and oh boy, there's been a lot of that, by missteps in public statements, by people who I think unfortunately maybe wanted to please something other than the truth. And then the extreme polarization of our country, which is making this so much harder than it otherwise would be. That polarization further enhanced by social media and sometimes even the mainstream media. A little poke there at our panel from the media, because come on guys, let's not slip into this polarization of everything circumstance that seems to be the only way we talk about any topic these days. Putting all that aside and dealing with the fact that we have this huge problem with vaccine hesitancy that needs to be dealt with, I am still guardedly optimistic that come 2021, we're going to be on a path over many months. Let's not talk about this being a quick solution, but on a path to where we can eventually put COVID-19 in the rearview mirror, although we will be changed by it, and I think it will be around us globally for quite a long time to come. Finally, just a shout out to the public servants who are making these kinds of things possible that I can talk about and say so positively. Tony Fauci, who last night was announced as the Federal Employee of the Year for the entire US government. Peter Marks, who I've already mentioned as just a wonderfully dedicated public servant. And Moncef Slaoui, who working for $1 a year has put all of his expertise, and it is considerable, and his skill set into overseeing the warp speed effort in this, and to whom we should be grateful. They are true public servants. I'm glad to have a chance to say those few words of summary to you, and recognizing the time is already past where we were supposed to close down, I'm going to stop my comments and turn this back to Dean MacKenzie.
Great. Thank you so much, Dr. Collins. You have given us a bit of reassurance, which is very much needed in these times. So thank you for that. Now, I'm not a vaccinologist and I don't work in the area of infectious diseases. I am trained as a biostatistician and have spent my career in health services and outcomes research, specifically as it relates to traumatic injuries. But as a public health researcher, I have spent my career profoundly aware of the importance of scientific integrity, data integrity, and the fundamental principle that while our science does need to impact the body politic, it must be free of political interference in the conduct, analysis, and reporting of our work. The primacy of science must be vigorously defended and upheld by us all. And our science must be conducted in a way that benefits all segments of our society. As was talked about earlier, we must ensure diversity and inclusion in the recruitment and participation in our trials. And as a professor, and now as a dean of the School of Public Health, I also know that it is vital to teach the next generation of researchers and public health practitioners the importance of scientific integrity. As a scientist, one's reputation for integrity is absolutely the coin of our realm. And as practitioners, we almost always lead with the science. Let me just add that I think we can all agree that any attempt to short circuit the current COVID-19 vaccine trials underway could truly have some terrible consequences for our country and the world. And that's why I think it's so important that we came here together to address these critical issues. So let me close by asking you to join me in thanking Dr. Collins, all of the extraordinary session chairs, speakers, and panelists, and our wonderful teams at University of Washington and Johns Hopkins who put together this powerful day. And thank you for your attention. And please stay tuned to this space. We have a long way to go to get a vaccine, but if we succeed in protecting the science, I'm confident we will get there and we can all look forward to a brighter future. Please stay safe and be well. Thank you.